An overactive thyroid, also known as hyperthyroidism or thyrotoxicosis, is where the thyroid gland produces too much of the thyroid hormones. The thyroid is a small butterfly-shaped gland in the neck, just in front of the windpipe, trachea. It produces hormones that affect things such as your heart rate and body temperature. Having too much of these hormones can cause unpleasant and potentially serious problems that may need treatment. An overactive thyroid can affect anyone, but it's about 10 times more common in women than men, and typically happens between 20 and 40 years of age. Symptoms of an overactive thyroid. An overactive thyroid can cause a wide range of symptoms, including swelling in your neck from an enlarged thyroid gland, goiter, an irregular and/or unusually fast heart rate, palpitations, twitching or trembling weight loss. Find out more about the symptoms of an overactive thyroid. When to see a GP? See a GP if you have symptoms of an overactive thyroid. They'll ask about your symptoms, and if they think you might have a thyroid problem, they can arrange for a blood test to check how well your thyroid is working. If the blood test shows that you have an overactive thyroid, you may be referred for further tests to identify the cause. Find out more about how an overactive thyroid is diagnosed. Treatments for an overactive thyroid. An overactive thyroid is usually treatable. The main treatments are medicine that stops your thyroid producing too much of the thyroid hormones, radioiodine treatment, where a type of radiotherapy is used to destroy cells in the thyroid, reducing its ability to produce thyroid hormones, surgery to remove some or all of your thyroid so that it no longer produces thyroid hormones. Each of these treatments has benefits and drawbacks. You'll usually see a specialist in hormonal conditions, endocrinologist, to discuss which treatment is best for you. Find out more about how an overactive thyroid is treated. Causes of an overactive thyroid. There are several reasons why your thyroid can become overactive. These include Graves' disease, an autoimmune condition where the immune system produces antibodies that cause the thyroid to produce too much thyroid hormone. About 4 in every 5 people with an overactive thyroid have Graves' disease. Lumps, nodules, on the thyroid. This extra thyroid tissue can produce thyroid hormones, causing your levels to be too high. Some medicines, such as amiodarone, which can be used to treat an irregular heartbeat, arrhythmia. Find out more about the causes of an overactive thyroid. Further problems. An overactive thyroid can sometimes lead to further problems, particularly if it's not treated or well controlled. These include eye problems, such as eye irritation, double vision, or bulging eyes, pregnancy complications, such as preeclampsia, premature birth or miscarriage, a thyroid storm, a sudden and life-threatening flare-up of symptoms, common symptoms. Symptoms of an overactive thyroid can include nervousness, anxiety, and irritability, hyperactivity. You may find it hard to stay still and have a lot of nervous energy. Mood swings, difficulty sleeping, feeling tired all the time, sensitivity to heat, muscle, weakness, diarrhea, needing to pee more often than usual, persistent thirst, itchiness, loss of interest in sex. Common signs. An overactive thyroid can also cause the following physical signs: a swelling in your neck caused by an enlarged thyroid gland, goiter, an irregular and/or unusually fast heart rate, palpitations, twitching or trembling warm skin, and excessive sweating. Red palms of your hands, loose nails, a raised, itchy rash, known as hives, urticaria. Patchy hair loss or thinning weight loss, often despite an increased appetite. Eye problems, such as redness, dryness, or vision problems. See complications of an overactive thyroid. Graves' disease. About 4 in every 5 people with an overactive thyroid gland have a condition called Graves' disease. Graves' disease is an autoimmune condition where your immune system produces antibodies that cause the thyroid to produce too much thyroid hormone. The cause of Graves' disease is unknown, but it mostly affects young or middle-aged women and often runs in families. Smoking can also increase your risk of getting it. Thyroid nodules. Less commonly, your thyroid can become overactive if lumps, nodules, develop on your thyroid. Nodules are usually non-cancerous, benign, but they may contain thyroid tissue, which can result in the production of excess thyroid hormones. It's not known why some people develop thyroid nodules, but they usually affect people over 60 years of age. Medicine. An increased level of iodine in your body can cause your thyroid to produce excess thyroid hormones. This can occasionally happen if you're taking medicine that contains iodine, such as amiodarone, which is sometimes used to control an irregular heartbeat, arrhythmia. An overactive thyroid that's caused by a medicine will usually improve once you stop taking that medicine, although it may take several months for your thyroid hormone levels to return to normal. Other causes. Other possible causes of an overactive thyroid include high levels of a substance called human chorionic gonadotrophin in your body. This can happen in early pregnancy, a multiple pregnancy, or a molar pregnancy, where a lump of abnormal cells grows in the womb instead of a healthy. Thyroiditis. Swelling, inflammation of your thyroid, which can cause extra thyroid hormones to be produced. Thyroid cancer. Rarely, a cancerous thyroid tumor can affect the production of thyroid hormones.